All right, this is our final segment with our guest this morning. The number is 737-7587. If you want to join in talking about suicide prevention with us, Misty Leitsch is with us, and Joanne Perley from the Tennessee Suicide Prevention Network. You know, I said earlier in the newscast, or show here rather, when we do a newscast and there's a suicide, first of all, we need to make it clear that we say died by suicide, not committed suicide. And I understand that, even though, you know, I used to say it differently as well. But on top of that, I mean, do you understand, and I guess you agree with our policy, unless it's someone like Anthony Bourdain or someone super high profile, we do not report in our newscast suicides. Now, we will, in general, report deaths depending, you know, on how they happen. But suicides we don't, and I've always been told that the reason we don't do that is that some people may die by suicide wanting to get attention, and I don't want them to think that if they kill themselves that they're going to get on the news that night. I think that's the thinking behind why we don't. That's one reason why we don't report suicides in our newscast.
Yeah, and a lot can come from that. We don't want to sensationalize suicide,
yes, right?
Like you're saying, we don't want to make it something that, oh, I want to be on the news, so yeah, let's die by suicide so that it'll be on the news. And also, as I said earlier, there's so much stigma around that suicide that a lot of family members have great issue with maybe even calling a death of a loved one a suicide, whether it was or was not, for different various reasons, of course. And there's just so many there's so many things that go along with that.
I'm glad you mentioned that. I'm just, with regard to the family members of those who die from suicide, and I imagine all of them obviously are horrified by it and saddened, and probably go back thinking about what did they miss, or were they callous to what? I mean, is it fair for family members? I mean, they will, but I mean, is it their fault?
No. So much no.
I just wanted to make it clear.
No,
even if they felt, I mean, they may have reached out at some point, they may have tried, or they may have not even seen it coming, but they're going, many of them will at some point blame themselves.
It's called survivor's guilt.
Yeah.
It's a real thing.
Oh, I can understand. Right, survivor's guilt. Yes. But so elaborate on why it's not a father's fault if his son dies by suicide, or a husband or wife's fault.
Whatever, yeah. Because, I mean, we can only do what we can do in that moment. We can only do what we know to do in that moment, A. And B, as you mentioned earlier, it is ultimately, unfortunately, in many cases, ultimately that individual's choice to take their own life if that is what they want to do. We can be there for an individual, we can love them if it's a loved one or whatever that might be, but it's really important to realize that there is nothing, we can't blame ourselves for the loss of a loved one. We can't. What we can do is, I know I went a little overboard as a survivor of loss, but we can work towards educating everybody.
Oh, you mean because you made it your career?
Yeah, I went like way too far.
Oh, no, I think it's lucky for everyone,
Well, thank you. But it's educating everybody on those resources and what we can do.
And one of the things we tell participants in our training, typically before we even get started with the training, is that you are not responsible for information that you did not have prior to this, and in efforts that it alleviates maybe some of that survivor's guilt.
Okay, yeah, because those folks who are on the other end of the line taking these calls, I'm sure they save a lot of lives, but there are times maybe where it doesn't happen. And you have to be prepared for knowing you did everything you could under that circumstance, but it doesn't always work out that way. All right, since this is our final segment, I just wanted to think, I'm trying to cover, what other pertinent points do you think it's important that we touch on? I have other questions, but since we're shorter on time, just maybe in the state of Tennessee where we stand, the resources available. I know for a fact that in general this entire state, probably the whole country, needs more beds for mental health treatment and frankly drug treatment, but mental health treatment. It's hard to get a family member who's, whether or not they're suicidal or something else, has help in a bed, unless you got a bunch of cabbage. You know what I'm talking about? I mean, it's very expensive, and and there's just, I worry about the resources for people who really need it.
Sure, and so in Tennessee there are several resources that are available, and oftentimes the inpatient hospitalization that I think you're referring to is the very last step. So there are multiple resources that one can go to before inpatient is necessary. So there's crisis stabilization units, there's crisis respite units, there's community mental health centers, there's, if you have private insurance, there's a mental health parity law. So if you have private insurance, they're required to provide mental health coverage as well as medical coverage.
Okay.
And so there's, becoming familiar with what resources are available in your community is very important. We have resource directories online for every county in the state. We have it broken up by regions, and so it's free to download, and there are numerous resources in our resource directories.
Okay.
Our website is full of resources where you can go to get help.
And things, because I've heard that to go get in and get an appointment with a good counselor, and I have not tried in years. I've been to a counselor before, though. I've just heard from others saying that it is hard to get an appointment. Counselors are very much in demand, and there's not a ton of them. I don't know. I mean, counseling can be part of the help, right?
Absolutely.
Talking about it and to be able to get into one. Are there enough counselors out there? I mean,
no.
Okay, I didn't think so. I mean,
I would love to see a counselor on every corner like a Starbucks.
Like that.
Like a Starbucks. And I wish there was no stigma attached to seeking help, just like there's no stigma if someone is a diabetic and they need to go get medical attention or supplies for treating their physical health condition. Our society truly needs to start looking at mental health as they do physical health.
Is it slowly getting that way? Because I understand you're exactly right about the stigma, especially, and you hear it sometimes with the veterans who come back, men and women. And these are toughened individuals that fought overseas and aren't afraid of much, and they need help. And you hear it time and again that the suicide rate, we know, is so high among the soldiers that come back. And one reason sometimes is that it's the perception it's a sign of weakness to seek help. And I don't know. I mean, we didn't touch on that. And we have Fort Campbell right here. But the number of suicides that have been reported out of there and such, it's higher than the average public suicide, right? So the stigma there of, I don't know that's changed.
It's slowly creeping that way.
I hope so.
That help-seeking behavior is definitely something that we all need to...
What we have to remember is seeking help is a sign of strength.
Yes.
And I truly believe that. It is a sign of strength that you have it within you to say, I need help. It's a sign, I don't want to say it, but is it a sign of weakness that you're afraid to seek help? I don't know if it's afraid or if you feel there's a stigma or whatever, but really you should view it as if you seek help, it's a sign of strength.
Absolutely.
And so hopefully more and more people do that. It made me think of some other cases and reasons behind suicide. Many of these NFL football players, Junior Seau comes to mind, and there have been others who suffer from CTE. It's a brain abnormality that comes from repeated blows to the head. It's not quite Alzheimer's, but I suspect it is horrible. It just doesn't function. And the thing is, there's no cure for it. I don't know why Junior Seau killed himself. I would guess that he might have come to the point where he could no longer live with the way his brain was operating anymore. And that's one reason he shot himself, I think, other than in the head, so they could use his brain to serve. I'm just wondering, is there a line drawn? We hear about mercy killing and euthanasia and things like this, the whole Dr. Kevorkian thing. Some states have different laws, but taking a life before it goes naturally is still considered dying by suicide?
Legally, yes.
Okay.
Yes. And what I want to, I want to sort of draw on that trauma, that TBI, that traumatic brain injury, and that other thing that you said. But it definitely, traumas, when we talk about traumas as increasing that risk for suicide, we think of events, we think of major losses, we think of major floods where we don't have a home to live, but also realizing that those physical traumas can definitely, especially in the brain.
Brain, or if you just have something that can't be treated that is incredibly chronic back pain, and you are constantly, or God forbid, you've got stage 4 cancer. And you're in pain, and the docs have basically said, barring a miracle, you're not going to survive more than 6 months, and you decide to end it so you don't suffer those last 6 months. Now, doctors, under the law, can't really legally do that. And so would that still be considered death by suicide?
Under the law, yes.
Under the law.
Yes, and I'm not going down there.
No, we're not advocating one way or the other, but that's something that happens. And you see states now around the country that are addressing some of these types of mercy-killing laws in extreme cases of folks who are in distress. But the bottom line is, we leave you with this, as we touched on all of it, and you guys do a great job, is just to hit everyone again with the idea that whether you're seeking the help or someone else is, it's there. Right?
Yes. Absolutely.
Always.
Okay, there's a whole network of them. There's very nice people like you that are there and non-judgmental, that will at least give you someone to talk to. And sometimes that's all it takes is some of these people are lonely and alone and they don't feel like they can talk to anyone, or they don't feel comfortable talking to family members about it because it's embarrassing to them or something. Call someone who is non-judgmental, that doesn't even know you.
Yes.
But that they're trained. And that's that number on the screen, 1-800-273-TALK, and that TALK is 8255. Again, that is always free. That's the National Suicide Prevention Lifeline. Do you guys hook into that, or that's just separate? Is there one of those everywhere? Or you might call that number and get a qualified counselor in Omaha, Nebraska.
Well, unlikely. So we have 6 call centers here in Tennessee who answer that number particularly.
That's what I was wondering.
So you'll very likely, if you call that number, be answered by someone here in Tennessee.
Does that make sense in the sense that maybe there are different dynamics depending on where you live in the country for types of things that could lead to suicide?
Definitely, definitely. So in our Rocky Mountain area of our nation, they have a very, very, very high rate of suicide. There's very rural areas. The frequency of firearms, the hunting atmosphere that they have going on there, they have a huge rate of suicide. So when you're talking to an individual there, that might be slightly different when you're talking to somebody in West Tennessee.
Makes sense.
In Memphis, right? That might be different.
Yeah, that makes sense. And it's regionalities, but ultimately, you know, there's all kinds of reasons why this happens. And again, being non-judgmental. Misty, Joanne, thank you for coming on. I really appreciate it. We were looking to do this show in the aftermath, but we should do it more often. If you guys have events or think there's things that need to be addressed that you find in the status of suicide in Tennessee, that notebook from 2018, just let us know, and we'll be glad to do that. The number's up there, but I want to thank you both for coming on. Yes, and just stick around. We'll have that back up again at the end, that you write that down. If you don't need it, share it with someone else. Thank you both again for coming on.
Thank you.
Back with a programming note right after this.